It's really common for us to work with young adults that are struggling, and you can feel like you're willing to do whatever it takes. You'll invest everything you have, you'll invest all the time you have, but it's just not there for your son or daughter to actually step in and engage in getting support. It can be really scary as a parent when you've got a teenager that just feels like it's completely out of control. You can sometimes even be scared of your own kid. It can be difficult. And so in those situations, it feels like you're totally out of options. And it's also really natural to say, let's ship them out to residential, get them out of the house. I can't deal with this. But at the end of the day, at some point, you're going to have to work through those difficult times with your son or daughter.
The problem is that I think when parents are frustrated, you're in a place of desperation. Like you've done all that you know to do, and you're just back against the wall and desperate. It's about not being at their beck and call in many situations. It's about saying no and having that be an acceptable response.
We definitely are a family program, so we encourage the parents to come in if you can. If you're a parent, one of the things you can do is start helping yourself, actually. So you can attend parent support groups, you can reach out to us and we can get you connected with a family therapist. That's one of the most powerful things you can do is start to take care of yourself, and so you're in a place that you can support your son or daughter best. And that's really the first touch point that we can show that we're working together in this process. It's not just your son or daughter that's coming in, it's the whole family that we're working with. So if you reach out to us, you'll talk to one of our admissions coordinators. We'll look at verifying your insurance, benefits, and coverage, and give you an estimate in terms of what the cost is going to look like. We can also help in terms of the insurance side of things. That's just a whole different animal. So I spend a lot of time trying to help support families really lower their costs as much as we can to use options that'll be covered by insurance if possible. And so we can help with that process so that you don't run in somewhere and end up with a bill that you weren't expecting, because it's unfortunate, but the financial side of things is a really big piece of the decision. Along that process, we'll help educate you. And so it's important to look at certain things like, what are the credentials of the team? What's the experience of the team? Do they have all the different parts of the programming? Do they have family support, academic and vocational support? Is there psychiatric support? Mental health, how do you address that dual diagnosis? So one of the things we really encourage is coming in for an assessment. It's just you spending some time one-on-one with us, you get to know us, and it's really important dedication of time for 2 to 3 months that hopefully can really impact you guys for a long time.